A breast lift is a procedure that is done to address sagging of the breasts. There are several different types of breast lifts, and the one you need depends on how much sagging you have, not on what scar you want to avoid. There is a donut lift, where the incision is placed around the nipple. This is for mild sagging. There is the lollipop lift, also known as the vertical lift, where the incisions go around the nipple and down. This is for moderate sagging. And there is the anchor lift, where the incisions go around the nipple, down and underneath. This is for severe sagging. Patients are often scared of the vertical incision because they do not want a visible scar. However, it is important to understand that the vertical incision may be necessary in order for you to get the best result. And actually, it often heals the best. These are some of the key steps that will ensure that you have a successful outcome and that you're happy with your breast lift. Surgical markings. They're crucial. Breasts must be symmetrical and have a beautiful shape. And that is all determined when your surgeon is marking your breast prior to surgery. This is where the artistry comes into play. Nipple inset and creating a natural looking nipple are often very challenging. During a breast lift, sometimes nipples are made oval instead of round. This is the telltale sign that you've had a breast lift, so it's very important that your surgeon be accurate. Layered closure. The way your breast lift is closed determines how you heal and ultimately what your scars look like. The closure is more than just the skin layers coming together, but closing each layer of the breast tissue underneath is also crucial for a natural and beautiful outcome. Therefore, I always close every incision myself. You will find that some surgeons have a tech close their incisions in order to expedite surgery, and as you can imagine, that's going to affect your scars. An often confusing topic when it comes to a breast lift is whether or not you should get a breast augmentation as well. An implant is not necessarily just to increase the size, although that can happen. A breast implant is often necessary to increase the fullness of the upper pole or the top of the breast. Without it, many patients are sometimes disappointed that they lack fullness. Breast lifts can be misunderstood. People think a breast lift is done to bring the breast up higher. And in truth, it's really designed to take the nipple and the sagging and bring them to a normal position. Now let's talk about the recovery. The recovery time for a breast lift is about 4 to 6 weeks. At 1 week, you'll go to your doctor and remove the bandages and the stitches. You will then wear a surgical bra for about 4 to 6 weeks, after which time you'll go back to life as you know it. If you and your doctor select the correct procedure for you, and it is done well, you should have a beautiful outcome.